May I call upon next speaker, Dr. Rasik Priya Sandhu? Please help her out.
Yeah, I want to start. Yeah. Good morning, everyone. I'm here to talk to you about the long-term outcomes of Cionni ring-back fixation in subluxated lenses. There are no financial interests. Loss of substantial zonular support leads to difficulty in lens removal and subsequent implantation of an intraocular lens in both children and adults. Nowadays, cataract surgeons have a multitude of options in their armamentarium to facilitate an IOL implantation. These include a scleral fixated IOL, glued IOL, Yamane technique, AC IOLs, and many others. However, one of the main advantages of using an endocapsular device is that we manage to preserve the capsular bag. That is, we maintain the physiological compartmentalization between the anterior and the posterior segments of the eye. We do away with the need of a vitrectomy and possibly any vitrectomy related complications. Most importantly, we get to place the IOL in the most anatomical position, which is the capsular bag. Also, another major concern in these eyes has been the biodegradation of the suture material. Since this capsular bag is sutured to the scleral wall using the suture material, the degradation of this material can lead to late decentration. This is of grave importance because most of these patients are young patients with a very long lifespan ahead. And in addition, they can have comorbidities such as Marfan's, homocystinuria, which predispose them to progressive zonular weakness. By now, it is well established that 10-0-proline undergoes biodegradation. Therefore, in our study, we used 9-0-proline. Our own group itself has been involved in the study and analysis of these eyes. But a restriction of the previous studies has been that they have been confined to a period of, say, about maximum 5 years. To the best of our knowledge, there are no reports in literature with a follow-up of more than 9 years. This was a retrospective observational case series, and all eyes underwent an MCTR fixation using a 9-0-proline. Subluxations of any etiology were included, and only those cases were analyzed where we had at least a 5 years post-operative data. So, looking at the results, what did we see? This cohort included 41 eyes of 31 patients. The mean age at surgery was about 20 years, with a wide range of 4 years to 50 years. It is very important to know that children, that is, below the age of 15, accounted for almost 60% of the eyes in our study. Not surprisingly, Marfan's was the most commonly identified etiology in about 40% cases. And in about another 40% cases, we could not identify any underlying cause. The mean follow-up was close to 10 years with a maximum range of 20 years. Most of the eyes, about 90%, received a single eyelet Cionni. The patients were measured in the CDVA and the incidence of post-operative complications. It is very heartening to see almost 3/4 of the patients had a best corrected vision of 612 or better, and only 10% had vision less than 660. PCO was the most common complication seen in about 41% eyes, and all underwent a NDR capsulotomy about 1.4 years after surgery. 7 eyes required a surgery for late decentration. In 4, we could refixate the original IOL bag complex using a Gore-Tex, and in 3 eyes, we had to explant and have a secondary IOL. It is not just pediatric eyes, but also adult eyes that undergo decentration. Therefore, all these patients need a very good preoperative counseling for the secondary surgery. This is a patient who underwent surgery, but say that the total biodegradation, the bag is dead stable. RD was seen in 4 eyes, about 10%, and 3 of these eyes already had a preoperative diagnosis of Marfan syndrome. In addition, in conclusion, I would like to say, it's a very skill-dependent procedure, but we should not be disheartened because the results are very satisfying. Thank you.
Have you done anterior segment OCT in a long post-operative period?
No, sir, we didn't do any OCT. That was not one of our outcome measures. we identified them on the CDVA and the incidence of the post-operative complications that I showed.
You are not interested to see the Cionni ring behavior?
So we did UBM for certain cases, like one of the slides that I showed. Post-operatively, whenever the patients would come at the scheduled visits, an UBM was done to see the centration and the placement.
Now, your very topic says, topic dictates that all the cases should have the assessment of the position and functioning of the Cionni's ring in the long term, because you have used the long term outcome of Cionni's ring. So it has to be assessed.
Okay, sir.
Okay. In your next series, you assess the UBM or anterior segment OCT for all the cases. It should be a protocol.
Yes, sir. So the UBM that I showed, UBMs are done for all these patients.
You have done for all the patients.
For all the pediatric patients that came in, because we have a separate day for pediatric ophthalmology.
In that case, if your data is stored in computer, you can always go back and review what sir suggested.
Yes.
So you can add up once it will add value to the study.
Yes,
The
because
data
that is very important,
Yes,
because
sir.
you have given the term long-term outcome following Cionni's ring bag implantation. So that should be documented.